Welcome back, Southwest Florida. We're so thrilled to get him here for the first time. Certainly won't be his last. Dr. John Paul Bettencourt, the Chief Medical Officer for McGregor Clinic. That's a fancy name, John Paul.
Thank you.
Chief Medical Officer, what does that entail?
So as the Chief Medical Officer, I'm in charge of making sure that McGregor Clinic has the highest level of medical care for our patients and our clients. Make sure that we are actually top tier providing care.
In a nutshell, what is McGregor Clinic?
So McGregor Clinic is a non-for-profit clinic that offers HIV services to patients and to the community. We also do a lot of outreach, and we provide funding and assistance for patients to get the medical care that they need and deserve.
Mm-hmm. You hail from one of the beautiful cities, in my view, in these United States. You came here by way of Boston?
Yes, that's true.
What drew you to McGregor Clinic?
So for the last 8 years, or about 8 years, I was a staff physician, then lead physician at Fenway Health in Boston, Massachusetts. And McGregor Fenway Health is a very large, very comprehensive care facility that caters to HIV treatment as well as other treatment facilities. McGregor Clinic is very similar to Fenway Health, just much smaller than Fenway. And McGregor offers an opportunity to expand services and to be much more like a Fenway Health, a community health center, and provide services not just to HIV individuals, but all individuals of the community. And that's what really brought me down. When I came down to interview, what really caught my eye was the commitment of staff. The staff here really do care about their patients and their clients, and they are committed at providing top-tier care to those patients. And you always want to work in an environment where people are committed to what they want to do, and it definitely was the case here when I interviewed here.
With my television show, I've interfaced with McGregor Clinic at least 20 years, and I can echo what you're saying. It's a very special place and concerned people, and it looks like they take a great deal in making sure that they try to hire the right people into that role. So it looks like they did a good job in bringing you on board.
Well, we hope so. We hope so.
As you look at HIV and AIDS on a let's say a country level, we are. I'm just asking you this for your information. When you talked about you were in a bigger facility in Boston, around the country, facilities that deal with HIV and AIDS, there are a lot of substantial size operations?
Unfortunately, no. Unfortunately, HIV is somewhat relegated to a smaller part of the medical spectrum. People forget that HIV even exists anymore. When I say
That's hard to imagine.
It is. It is. When I say I'm an HIV specialist, I actually get the questions, oh, wow, that's still around. Really? And that's unfortunate. It's both fortunate and unfortunate. It's fortunate in so much as we have such great medications now that HIV and AIDS is not the death sentence that it was back in the 80s. And so it doesn't get the press that it did back in the 80s and 90s. The unfortunate part is people don't think of it anymore, and they don't necessarily get tested like they should get tested, and they don't think about the high-risk behaviors, and unfortunately, they don't avail themselves of the medications that we now have to help protect them against transmission of HIV. And that's why HIV is on the rise, and it has been on the rise, along with all the other sexually transmitted diseases. And we really need to get control of it because it is something we can control. We do have medications now, we do have systems now, and amazing testing where we can identify people, get them into treatment, get them treated, and really make sure that HIV becomes more of a chronic nuisance, to be honest with you, than a death sentence that it used to be.
I'm glad you said that, because you say it's on the rise, but people are not conscious of it.
Right.
So at a very basic level, it still comes down to the simple know your status.
Yes.
And what are ways that people can know their status?
Without question, getting tested. The CDC recommends that everybody between the ages of 13 and 65 be tested at least once in their life for HIV status. Know your status. And then if you participate in higher risk activities, either having multiple sexual partners or IV drug use or what have you, get tested on at least an annual basis, if not more frequently. If you can get tested, then you can know. If you can know, then if needed, you can treat, or if not, if you're HIV negative, then you can get on PrEP, pre-exposure prophylaxis, which reduces the risk of transmission by up to 99%. And so really the first step is getting tested. And at McGregor Clinic, we offer free testing, free anonymous testing Monday through Friday, as well as through a mobile clinic, mobile unit. And so there's really no excuse why not to get tested.
Do you need to have any type of symptoms or anything to get tested?
No.
Is that a good, you just should on an ongoing basis, just like you get your blood pressure checked, or probably not as often as you get your blood pressure checked, but I'm going to let you be the expert on that. How often should you get tested?
Honestly, it depends upon your risk. If you're involved in higher risk behaviors, you should get tested more frequently. If you're not involved in high risk behaviors, at least once in your life to know the status. If you're in a monogamous relationship, and I underline the word monogamous there, then getting tested once is probably okay. If you have other sexual partners or you participate with illicit drug use, I would suggest getting tested much more frequently. Because again, if you can detect the HIV status early and you can treat it early, the likelihood that HIV will have a long-term impact on your life will be significantly reduced. And that's the part. We want early diagnosis and then early treatment, early access to care.
There's no face for HIV and AIDS?
No. There's
demographic, people.
The virus doesn't care. It simply doesn't care. All the virus cares about is being transmitted. And so it doesn't matter who you are, how much pigment is in your skin, it doesn't care. We do know that the highest risk populations are those of the Hispanic men who have sex with men population, as well as African American, both men who have sex with men, as well as heterosexual population. Those are our highest risk because often they're not getting tested.
Right.
And they don't have access to care. If we can get them to be tested, if we can get an individual to be tested, then we can get them into care and help them either with pre-exposure prophylaxis medication or with treatment. And that's really the defining factor of what the long-term progression of their health is going to be with respect to HIV and other things.
What about your income status? Let's say you test positive and you need all these fancy medical things that you just named, and you don't have the money. What about that?
Yeah, there are programs. In fact, the McGregor Clinic uses the Ryan White program, and that's designed for individuals who are HIV positive to help get them the medications. There should be no reason why, if you're HIV positive, you don't get medication. And that's not just from an individual standpoint, that's from a public health standpoint. Because if we can get an individual to have a viral load of less than 200 virins per milliliter, if we can get them to be undetectable, essentially, the likelihood of transmission becomes essentially zero. And so we can stop future transmissions of HIV by getting that individual who is positive to an undetectable level. Not to mention that individual who is now undetectable, they're not going to die from HIV. They're going to die because they're an American with high blood pressure and cholesterol and diabetes and everything else, because HIV is no longer going to be a main driving factor of their health care.
HIV and AIDS are two different things.
So HIV is the virus that causes AIDS. AIDS is the medical syndrome where your immune system is no longer able to fight off opportunistic infections, infections that otherwise your immune system could fight off, but because it's been disabled, essentially, it can't fight off these otherwise simple things, and either infections or cancers.
And that's what will kill you.
That's ultimately, it's not actually AIDS that kills you, it's the opportunistic infections that kill you. HIV takes out your immune system, and so now you're open to infections by things that otherwise it'd be able to take care of.
Now that you got your boots on the ground here in the Fort Myers area at McGregor Clinic, what are some innovations and things that you see on the horizon under your medical direction?
Yes, so we're in the process right now of strategic planning, which is going to help make the plans for the future and inform our decisions. One of the things we absolutely want to do is we're working on creating a pre-exposure prophylaxis program, so individuals who are not yet HIV infected but are high risk can come to us and get put on medications, and that's going to reduce their likelihood of getting the disease, getting the virus by about 99%. Really reduce their risk. We're working on creating an STI clinic and trying to help reduce the rate of gonorrhea, chlamydia, syphilis, because when you have a sexually transmitted disease, that increases the likelihood that you're then going to contract HIV. We're working on increasing education. Education not only for our patients and for members of the community, but also helping to educate the future clinicians, the future pharmacists, by having rotations with medical students and residents, pharmacy residents, medical residents, so they can learn how do you treat someone with HIV, how do you treat someone who has complex medical care, and also how do you prevent HIV in the future. Because if we can get more knowledge out there, then we can help prevent the transmission of HIV. Knowledge is power, and we want to really empower people.
Is there a unique problem in reaching the younger generation? Teens.
Yeah, so one of the problems with teens is the Superman complex, where it can't happen to me. And it'll happen to somebody else, but it can't happen to me. I saw that, unfortunately, a lot in Boston. I had a lot of patients who were college age, and this was the first time they were in the city. This is the first time they were potentially sexually active, and they contracted HIV. And the stigma is not out there usually until you catch HIV, and then you could see the blood just drain from their face, the fear that develops. The benefit now is that we've got medications where I can help them, and I can make HIV not a huge concern in their life anymore once we get past that initial shock. And that's the services we want to bring here to McGregor Clinic. We want to be a full, holistic, comprehensive care model where we can help patients, in no matter what age they are, deal with the risk of HIV and really reduce their risk to contract AIDS and to have the consequences of AIDS.
What's your thought on those over-the-counter type? I think they have kits now that you can purchase in the pharmacy and test yourself and things of that nature. What's your thoughts on those?
So those are good, and those are out there because we want people to test no matter what your situation. And unfortunately, there is a stigma with HIV testing. So those kits allow people to maybe test in the privacy of their own bathroom and not come to a facility if that makes them nervous. But they do need to talk to a physician afterwards because you do want confirmation. You know, tests are never perfect, and tests are designed to really not have any false negatives. It's okay if you get some false positives, but you never want to miss a diagnosis.
Okay.
And so you want to bring them in for confirmation testing.
What are doctors, physicians in general, when you go in for your physical, you have to tell them when they do your blood work that you want them to include the HIV test in there, right?
Sure. Some will tell you. Some will offer it to you. They should be getting a sexual history on you, and if you're high risk, they absolutely should be doing the testing. But it's your own care. It's your own body, and you need to be your best self-advocate. So if you feel you need testing, and go ahead and say that. And if you're with a physician or a clinician that doesn't want to do the testing, then come to a facility like us, and we're more than happy to help getting the testing that you need.
Okay. Well, Doc, it's just been such a pleasure to have you here on the show. I want you to take 30 seconds, look into that camera, and make your appeal in a succinct way to encourage people to do what you need them to do.
So the biggest thing I can recommend is getting testing. If you get tested, then you can know your status. If you know your status and you're negative, you can go on to PrEP, which is medication, as well as practice safe sex practices that reduces the likelihood of transmission. If you're positive, you want to get into treatment. You want to stay in treatment. We have amazing medications now with very little side effects, and it's really a game changer. I got to be honest with you, even though I'm a little biased as an HIV specialist, I would rather have HIV in 2023 than diabetes. It's that good with our medications now that are that amazing.
That is great to hear. Doc, it's been a pleasure to have you. Let me bump you out.
It's been my pleasure.
All right, remember, for those who say it can't be done, they're usually interrupted by those like this fine doctor here at McGregor Clinic. And Miami may have the oranges, but Fort Myers has got the juice. We'll be right back.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello everybody, this is Lee. I'm so glad that you watched that particular show, and if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel, watch Lee Pitts Live on demand anytime, and also hit us up on all our social media platforms. Just type in Lee Pitts Live, and there you go.